most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Because we're the most famous physical therapists on the internet, Brad.
In our opinion, of course, Bob.
Today, we're going to talk about 4 easiest shoulder exercises to stop pain at home. We include frozen shoulder, impingement, and arthritis. I just had a couple of arthritis patients, and some of this stuff worked beautifully.
Beautiful.
Yeah. So,
and that's the beauty of this. At home, you can do it. You don't have to spend lots of money on expensive things. And it's just, that's the whole goal.
you can spend it on your wife instead.
There you go. Well, okay. I got a fishing pole I'm thinking about, so maybe that'll come
All right.
first.
If you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, we're always giving something away. Go to, we're going to keep it a secret what we're giving away. Go
That's
to
right.
bobandbrad.com, go to the giveaway section, and sign up for our contest. We're always giving to somebody every week. You can also go to Bob and Brad on Facebook. It's pinned at the top of the page. If you want a shorter version of us, go to Twitter or Instagram. We have a 60-second version of our show.
There you go.
All right, Brad. So what's the number one goal when we got
Well,
frozen
typically,
shoulder?
anytime you have shoulder pain, there's associated limit or lack of range of motion. And if you can regain range of motion, the pain will go down oftentimes, the majority of times. The trick is figuring out an exercise where you can regain the range of motion without irritating it.
Right.
And that's what we have here. We've got a few different options. And the first exercise we're going to show, usually we use with arthritis, but there's a couple other ones for arthritis too. But it's simply if you can have some overhead pulleys.
Right.
Now, Lonnie, can you come over here? You can buy overhead pulleys, a pulley that hook up to a door. Sometimes,
Fairly inexpensive.
yeah, fairly inexpensive. Sometimes, I don't know, $10 to $20.
Yeah, the $10 range.
Now, this set here, I actually made at home. If you are handy, it's just some kind. Actually, this is parachute rope. I don't know if it's really parachute rope, but they call it. It was relatively cheap. Get a pulley you can get at the hardware store or online, and then a place to hang it from the ceiling. I've had a lot of patients over the years. They got someone handy at home and they just make something up, or you can, like I said, purchase them. But anyways,
what's nice if you buy a pulley, it's usually better quality than the pulley system said. You know what I'm saying? When you buy the full pulley system, the pulley's not that great. But if you buy a pulley from a hardware store,
oh yeah,
I'm just talking about this piece right here.
Right.
Yeah.
Oh, right. Yeah, this is a brass one. This is gonna
that's going to last a long
this will
time.
last your shoulders.
Yeah.
Especially if you make sure you put drop oil in there. But anyways, you want to set them up so that your shoulders. Now, some people have bad arthritis. They may not be able to get this high, and oftentimes it's one shoulder. So you want to start in that pain-free range. If this is my painful shoulder, I'm going to go up, and I'll have my patient say, just go up until you start to feel some pain. Don't push into the pain and think you're going to break it loose in the first day, because you'll probably get real sore. So we're just going to work into it. And usually 3 to 5 minutes on the pulleys. The first day, probably just 2 or 3 minutes to make sure that it doesn't get real sore the next day. If it responds well, the next day you can increase the time up to 5 minutes. That may take a few days. And you're just going to repeat it over and over, relaxed, and get a nice chair to sit in so that you're comfortable.
So the thing is with shoulders and any joints, we have what is called synovial fluid, which is kind of like a grease almost.
Right. It's the lubrication of the
lubrication, joint. And this helps kind of promote that.
Right.
Now, I do find sometimes, Brad, when arthritis is so bad, like it starts creaking.
Yeah. Sometimes it's audible.
Yeah, it's audible. And any movement just makes it worse.
Yeah.
We can't do anything with them. But generally, for most people, this is going to help.
Right. I'm glad you brought that up, because there is a point where
you're beyond help. I'm afraid to say, but
right. Or there's replacements.
Yep, there's shoulder replacements.
They're doing much better at that.
Yeah.
The next thing is impingements. Now, impingements is in the shoulder. The symptoms are oftentimes once you get up to about 90 degrees or here, it starts to hurt, and it may hurt bad. Sometimes you get it to here, but then you get it up to a certain point, and it's like pain-free up here, ouch here, and then better here. Typically, that's the impingement syndrome.
Yeah, and generally the pulley system is not going to help that.
Right.
You're going to need to use the
the
BOOYAH stick.
The BOOYAH stick. And
grab a red one too, Brad.
Red one too. Okay, hold on. Listen, wait. There you go. So you don't have to have a BOOYAH stick. You can use anything that's about 5 foot long. A bigger diameter helps a lot. At
Right.
least about an inch to an inch and a quarter diameter. It just makes the grip much easier.
So my son-in-law, had tried PVC pipe,
Hmm.
and then he tried a Booyah stick, and he's like, it really. Brad and I had a discussion. It really is better. This is high quality furniture grade,
Right.
and it's really like tacky, sticky.
Yeah, it's better.
And you'll
There's
find
a
out why
clear difference.
you will find out why this was needed, because when we're doing, can I go into it?
Go ahead to this is our Statue of Liberty stretch.
Statue of Liberty stretch. So you're getting a little traction on the shoulder,
Mhm.
and this works wonderfully with impingement. So you're going to go ahead and you're going to lean forward like this. And now I'm putting a stretch on the shoulder. I'm real comfortable. I'm not working that hard. It's not like hanging from a pull-up bar where you got to work hard because you're hanging with both
Right.
arms.
You can do it standing as well. Right now I'm doing when you lean
Yep.
forward, it puts a stretch on that shoulder. And what we're doing is we're expanding that gap where the impingement is so that it doesn't exist anymore.
Right. And I had a little bit of shoulder impingement. I did this one. I still do it every morning.
Yep.
I do it when I do my calf stretches. I do them at the same time. But I also do the chicken wing,
Ah, yes.
famously named by Brad.
But
So-
invented by Bob.
So this is going to be for this left shoulder. So you take the Booyah stick behind you. Palm is going out.
So this is the shoulder that has the impingement.
Yeah. And for some people, they may not be able to go any farther than this. And they'll have to work the arm up like this for a little bit.
Yeah. And that may take a few days. It
Yep.
may happen. So don't get too aggressive with it the first day.
Yep. And then eventually you're going to go out like this. So
Yeah.
you can see this arm, the palm is down or facing toward me, and I'm pulling down, and you don't want to hit the head. You got to put it on the side of the head, and this stretches the shoulder. And again, I can't say this enough. This was like a miracle for me, Brad, because I was having really irritating pain
Right.
in that shoulder. And when you're a therapist, it's kind of a bad scene to be hurting.
Uh-huh.
So
I just want to say, if your shoulder is really bad and this is really painful, that means it's not ready for it.
right, pain is always your guide here. None of these things should hurt.
Right.
And actually, I'm going to mention this, Brad. I just had a patient that we discharged yesterday that had shoulder arthritis, and one of the few things we had him do is this Statue of Liberty.
Statue of Liberty. Mhm.
And they loved it. I've had a couple of arthritis type patients and they love that
Yeah,
Statue of Liberty stretch.
sure. It's easy to do.
It's easy to do,
Yeah.
and they gained. I mean, he was like here. He's moving up here now, so
Hmm.
it's like a new wing.
Well, it is.
Yeah.
So, and then finally, but not least, a frozen shoulder. You can do some of the same things here. You can do the Statue of Liberty stretch. Now, if your shoulder is tight at this point, you can, work it like this. We got a rubber tip here. You can do this on a table and it should not slip. If it does, it won't work. But you can go there and then you can keep bringing the hand up.
Yeah,
and
good point,
stretching
Brad.
And way up to here. And, you can hang some body weight on there. I'm really getting an aggressive stretch here.
Now, the mechanism frozen shoulder is that there is kind of an inflammatory process, and it
Mhm.
tends to last a certain amount of time, no matter
Right.
what you do. But I think the stretching definitely can help, so it doesn't get as
Sure.
bad.
Right.
So,
You could use the pulleys as well with a frozen shoulder
sure, yep.
to work on it.
That's what I often recommend.
You don't get near as much, it's not as aggressive.
Right.
I would probably tend towards that. Or
Or
one of
get
my
the-
favorites is the ball. If you got a ball like this, and you can just roll it here and like this. So you've got all your weight supported onto the ball. It's nice and soft and cushy. And you can use both arms like that. And once it gets better, if this was my frozen shoulder, then I would just use that shoulder, that arm all by itself. And you may work this 10 to 20 reps and do that 2 or 3 times a day. Again, the pulleys, 3 to 5 minutes is probably the max you're going to do. And the rest of these 5 to 10 repetitions as far as the chicken wing,
Yep.
as well as the
Yep. A couple times a day you can
Statue
do
of
it.
Liberty.
I've seen people take a towel, Brad, and put it on a table and do this.
Oh, sure.
Kind of similar to the ball
Yep.
or on a countertop.
Yep. Then you don't
Just
need
work
if
it-
you don't have a ball laying
You don't
around.
have a ball. If you don't have a
Right.
ball, you can use a towel. So,
Right.
all right,
So,
Brad, very good video.
yeah, there's just so many options that you can do at home without buying tons of expensive
Just
equipment.
remember, pain-free. Everything is always
Exactly.
going to be pain-free.
Stretch pain a little bit, but no sharp pain whatsoever.
All right.
Wow.
Thanks everybody for watching.